Revealing Jesus, releasing destinies. This is Celebration TV.
As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Momo. Join me and my colleague, Dr. Keith, on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority. Hello. Welcome to Health Talks. As you know, it's not a dull moment, and it's never a dull moment in Health Talks. I am Dr. Amy Momo, your host today, and we are going to have a lovely talk, an important talk on breast cancer. We have with us our co-host, Dr. Kate.
Good afternoon, Dr. Amy Momo. It's always a pleasure being on set.
Here,
Good afternoon, Celebration TV viewers. Welcome to Health Talk today.
So today we're talking about breast cancer. It's obvious, and it's very obvious that most families, or let's say family members, suffer from this breast cancer. I wouldn't say most families, because some people do not suffer from that. But the truth is, it is emotionally depressing. And the fear and the fright of this breast cancer cannot be swept under the carpet at all. So we're here to give enlightenment to the viewers and everyone concerning this breast cancer.
Yeah, it's quite a sad one. The incidence of breast cancer is on the rise, actually, and it is devastating to families. Totally. You can imagine when you have a relative who has cancer. So many things run through your mind, and it's usually not easy for them.
At all. Yeah. And the prevalence have increased, even the incidence. Do you know that about 2.3 million persons in 2020 was diagnosed of breast cancer worldwide, and 689 persons actually died of breast cancer. This is the record, or the report given by the World Health Organization.
And the truth is, that's the record that was kept. We sure know that we have several people, especially in developing part of the world, that will have breast cancer and will not even present to the hospitals. So they are not even part of those records that you have. And those ones are just for women alone. Men would also have breast cancer. However, the incidence is low for men with breast cancer. Less than 1% of all breast cancers occur in men. And it's estimated that in 2021, we are going to have more than 2,650 cases of breast cancer in men. Wow. And it's expected that about 530-something are going to die from male breast cancers. And a lifetime risk for, if you are a man, 1 out of every 900 men has a lifetime risk of coming down with breast cancer. So
it's obvious that breast cancer is not just restricted to the
women,
female folks, but
it's commoner in females.
However, yes, it's commoner in females. So the risk factors of breast cancer is what? The female gender, as well as the age.
Yeah, if you are a female, you're already at risk of coming down with breast cancer. Yes. And then age, like you said, too. Yeah.
So these two are actually the most identifiable risk factors.
Yeah, and then you look at the family history too of a person. When you have a first-degree relative that has had breast cancer, by first degree we mean either your mother or your sister has breast cancer, you are at risk of having, in fact, your risk is like 4 times higher than somebody who doesn't have a family history of having breast cancer.
And the reason is that there are some particular genes that could be mutated, meaning the genes actually change and do not behave like normal ones.
Yeah.
And these genes, we call them the tumor suppressors genes. Those genes stop breast cancer. And when that gene is mutated, what happens? Breast cancer comes.
Yeah.
All right, that gives us a definition of cancer. Because some of our viewers will be like, what's actually
cancer? Okay.
What's cancer? Cancer is actually cells that behave irrationally. Normally, when the cell is born, it goes and it grows and undergoes what we call apoptosis, meaning cell death. So, when the cell grows and do not die and end up becoming immortal,
Yeah.
starts metastasizing, meaning going from behaving arrogant, going from one organ to another, proliferating and all. That is what cancer.
Yeah, when cells behave abnormally during their division,
Yes.
yeah, it's a cancer. And then some of them are likely going to start spreading to other tissues and causing damage to those tissues. And the other risk factors associated with breast cancers per se, we say nulliparity, a woman who hasn't carried pregnancy to term. Yeah, maybe has not been pregnant or did not carry pregnancy till delivery. And then breastfeeding too is also a risk factor when people do not breastfeed for a long time.
Exactly.
You know, breastfeeding will confer some level of protection on the breast.
Yes.
Especially if you are doing exclusive breastfeeding, those months that you are not menstruating, it will reduce your risk of coming down with breast cancers.
Yeah, but if you don't breastfeed, breast cancer can actually come in. Also, radiation. Radiation. When one is exposed to radiation, one is exposed to even hormonal contraceptives for a long time.
Yes, especially the combined oral contraceptive pills. When people use hormonal pills over a long period of time, like 10 years period, it increases their risk. Why we know that hormonal contraceptives are also very important for women, for child spacing and all that, and even in management of some medical conditions. Prolonged use of those pills, and even post-menopausal women that are put on hormone replacement too, they also increase their risk of coming down with breast cancers. Yeah.
Then environmental factor.
I've talked about smoking too. Smoking is also a risk factor, whether you're an active smoker or a passive smoker. An active smoker is one who smokes. A passive one is one who has maybe a spouse or close people around them who smoke and they inhale all these things. Yeah. Alcohol intake too would increase the risk of breast cancer. So.
Also, obesity. Let's not forget that. Sedentary lifestyle. Lack of exercise, eating habit, obesity, as we said, all these
people
things
consume a high amount of fat in diets too would all increase their chances of coming down with breast cancers. No.
So now
we have some protective factors too.
Some protective factors. We talked about breastfeeding. Exclusive breastfeeding actually helps, and we just explained that. You just explained
even
it.
Breastfeeding for a long period of time. That's how we advise women to breastfeed for at least for 2 years. I know it's difficult for women to do, but breastfeeding,
for 6 months is important.
It confers some level of protection on people, and then other protective factors.
Like exercising, physical exercising, watching your weight, actually it helps.
All those ones would also help to confer some level of protection.
Then also avoiding exposure to radiation.
It said that when people are exposed to radiation, especially for young women who are exposed to X-rays before they are 30, it increases their risk. Then one of the risk factors too is people who attain their menses at a young age. If you start menstruating before 11, 12 years, it increases their risk too. And if they now attain menopause, when their menses ceases, at a later age, once it is late, it increases all their risk. Then one protective one too is a women who get pregnant before they are 20.
Okay, that is...
Yeah, it confers some level of protection, especially if they carry the pregnancy to term. Because that first pregnancy gives the breast some final maturation that will reduce the incidence of breast cancer.
But you know, it does. But you know, these days where we have working class women who do not want to get married on time, or give birth on time. Well, anyway,
but that's not the only protecting factor, though.
It's one of the protective factors.
It's just one of them. Yeah.
You can
and then
have your kids on time. It's a good thing.
Yeah, and then breastfeed exclusively.
Yeah, breastfeed exclusively.
So those are some of the risk factors.
Okay. We have the number on the screen, so please feel free to call us. And if you have any complaint, or you feel you're not feeling so healthy, or you notice a pain, or any health issue, feel free to talk to us. We are here to answer you. We are here to attend to you. Based on this topic and also any other issues, we are here to answer. Thank you. So,
all right. Now, when we look at these factors coming into play, like we said, for cancers generally, especially for breast cancer per se, you may not really have a cause that you are tying to it, but you have several risk factors, and some of them are modifiable risk factors.
Yes, many
okay. So what are the causes? Yeah, there are factors that you can modify, like alcohol intake, smoking, an unhealthy lifestyle, sedentary lifestyle. You stop those ones, and then you reduce radiation exposure per se. And then some pesticides too are also implicated.
Sure.
Yeah. So avoiding exposure to all those herbicides. But the ones that you cannot modify, once you are born into a family that has somebody with breast cancer, so the risk is there. Yeah. So it's important that people identify that they have a family risk of breast cancer, or they probably have a personal risk for any other, especially ovarian cancer, for example. People who have ovarian cancer are likely going to come down with breast cancer.
That's why we'll go to that gene issue we to discuss. Like, you have this BRCA1, BRCA2 gene, when they have the mutation in it. And so if this gene that actually stops cancer is mutated, such gene, and the gene is this mutation occurs, of course, in the family lineage. Such person with such mutated gene will have ovarian cancer most times and breast cancer.
Yes,
so
they happen like that once you have those gene mutations. And even you find out that one of the protective factors that we talked about now, age protects against breast cancers, like we have said. However, we know that breast cancers are commoner in white Americans and also in blacks.
Yeah.
And blacks usually have a more aggressive form. We in Africa, because they occur at a younger age.
Yes.
And they are very aggressive, and many of them are triple negative. They will not respond to hormonal therapy. Yeah. And then for women who come down with breast cancers at a later age, after 70 years, they are usually also going to have very aggressive ones. But the beautiful thing about them is that they are usually hormone responsive. So they respond to treatment, unlike those ones between 40 and 60 years.
Now, talking about this, now, the questions that might be in some people's mind now will be, what are the signs, early signs of breast cancer? What are they? Okay.
Now, breast cancers may just appear initially as a lump, maybe a swelling on the breast, and most times they are usually painless.
Yes.
Less than 5% of them will start with pain from the beginning. So more than up to 95% will just have a swelling on the breast that are usually painless.
They might just notice, people might not notice that, but they might just notice that their breast, one is kind of bigger than the other, and the texture is kind of hard and
so they may notice that the breast is bigger than the other. There are skin changes that occur. they may see that the skin will begin to dimple.
Like, you know, the orange, how the orange...
the back of the orange is. So the breast begins to appear like that. Some of them may have the nipple retracting back inside because of the tension in the muscle. Some of them, when they press the nipple, they'll see discharge, which is usually blood. Yeah. And then, but by the time it gets to this stage, that means something has gone far. So, for some of them, because they notice a lump that is usually painless,
they just forget and like, no big deal.
Yeah, they may not do anything about it until it becomes complicated and probably have metastasized.
So it's important for anyone to go seek medical attention in your physician. If you notice any lump in your breast, any lump, go seek your doctor. Go look for your doctor.
No matter the age of the lady, once you notice any swelling on the breast, you should see a physician. They should have investigations done, and then they can easily find out if it is a cancerous one or not. Okay, now a question there. Because the lump is not painful, it is not cancer. Wow. Yeah, that is not true.
That's not true.
Yeah, some cancerous lumps will start as painless swelling, and yet they are cancer. However, we know there are many. Yes, we also know that there are many painless lumps that are not cancers. Yeah. The only way you can find out is by doing a biopsy and taking to the lab and check whether it is cancerous or not.
In fact, it's said that about 5% of these lumps are actually cancers. However, when you see...
Once you notice any lump, run to the hospital.
Run to the hospital
and then it is investigated as much as possible. Yes. So, moving on. Okay, consuming too much sugar can cause breast cancer. No, these are myths concerning it. Why we know that cancerous cells require a lot of glucose to multiply.
Feed on glucose to multiply
their cell cycle. But consuming sugars per se would not increase the risk of. But why we know that consuming a lot of glucose and all that can tilt people towards obesity. And obesity is a risk factor for breast cancer.
But it's not a direct cause of
it is not a direct cause of breast cancer. So now, having looked at risk factors involved, we looked at protective factors too against breast cancers and the risks that increases the chances of coming down with breast cancer. Now, there are things that women should do. So what are the remedies or preventive measures for breast cancer? Okay,
that's really good. You know the remedy and preventive measures. But actually, we have before we get there, we have to talk about we'll talk about the screening.
For preventive now, for cancer treatment or cancer diagnosis, we say early detection is usually key. If you detect it early enough, chances of survival increases.
But detecting it does not checking or observing yourself. Detecting does not mean it will end the cancer or it will prevent cancer. Checking yourself to know if you have a lump does not mean that it will prevent it, but early detection helps in the management and helps to prevent what?
If you look at self-breast examination, breast self-exam that we advise women to do, what it only helps them do is that it helps them understand the architecture of their breast.
Yes, and notice anything
so that any day a strange feeling is observed, they are able to quickly identify it.
True. And so it is important that ladies, most times, of course, men should do that.
Yeah, men should do that
too. They should actually check their self, should know their body. So it's advisable that once a month, an individual should check or examine his or her breasts.
Yeah, for women, for example, women who are still menstruating, we advise them to do a breast self-exam days after the period, 23 to 10 days after the start of the menses. That's because, okay.
Sorry, yeah, because, you know, normal period, hormonal change, the breast could be tender. She could even feel some lumps there. Because of the lobules and all the stuff, but it is not cancer. So when those hormonal changes and all those things are finally gone off after the period, then she can feel free to check herself.
Yeah. So and then we say for women who have reached menopause that are no longer menstruating, they should look for a particular day of every month and do their breast self-examination. And then the process. Okay, I think we have a call.
Yeah, we have a call from Abuja. Pastor Special from Abuja. Hello, Pastor Special. We can hear you.
Okay. I can hear you also. I want to contribute to what you are saying.
Okay.
When we look.
Hello?
Unfortunately, we can't hear Pastor Special.
Breast cancer. Yes. When we be looking at breast cancer to be something physical, because we have to address it spiritually before, physically.
Okay.
Hello, are you hearing me?
Yes, sir, we can hear you.
Are you hearing me?
Yes.
Yes, sir, go ahead.
Yes.
Sir.
So, thank you very much. As believers, when a woman begins to have symptoms of cancer, it should address it spiritually. You understand me? Because I have seen people.
Hello, Pastor Prosper.
Unfortunately,
Pastor Special, sorry.
unfortunately, we lost Pastor Special. I love that his contribution.
Yeah.
It says we should address it first spiritually.
And I agree with him because this cancer is like the cell just go haywire.
Something that has attained some form of immortality. It requires Jehovah the doctor to deal with some of them. Sure. While we don't undermine the place of medical science, but we know that God does healing. Yes. Yeah, even some people will be managed for breast cancers with everything medically possible, and they succumb. So we know that God does all the wonders, and he heals cancers. We've seen them in Jehovah the Doctor. We've seen them under administration of our Father. Cancers are healed. Yeah.
So even with the medication and all,
we agree with you, sir.
Undermine,
the place of miracles in breast cancer. Exactly. Yeah. It says carrying a phone in the breast pocket causes breast cancer. Well, this is not entirely true because it has not been proven. We know that phones emit radio frequency waves, but they are usually low dose waves. But because it has not been proven, we don't advise people to carry phones on their breast pockets or on their bra. But it has not been proven that they can cause breast cancer. So we talked about breast self-examination and then the processes that are involved.
Yes. So we have to, our viewers have to know about this.
Yeah.
Okay, because it's not just by looking at the breasts or just by believing you are okay. There are some processes or some steps taken. Most we've talked about the timing. You should do the time. You should do that. Yeah. Then when you're in the shower, you can actually examine your breast, and we gave an illustration earlier on how to do that.
There was an illustration on the screen.
You check the breast around it. You raise one hand and feel whether you feel a lump. Then when you get out of the bedroom, you go to your mirror, look at yourself, look at the mirror, look at yourself with your hands down. Okay, we have the illustration here. With your hands down, what are you looking for? You look for
skin changes.
Or if one breast is bigger than the other, or if there's nip dimpling or anything. You look. Thereafter, you raise up your hands and you look also. You look for asymmetry of the breasts to know whether both of them are symmetrical, and also same thing. Then you put your hands in your waist. You put your hands in your waist. Thereafter, okay, then you come to palpate. You palpate, you touch around your breast to check for know if there's a mass or yes, for lumps. Check around for lumps around the breast, even to your armpit region and to your collarbone region. Thereafter, you lie down and do same. So this is what these are the processes.
That's how to do
yes.
the self-breast exam. You squeeze the nipple.
Yeah. Finally, you squeeze the nipple
and see if you get any discharge. Usually, a bloody discharge is usually of concern for us for breast cancer. So now, this can be done by individuals on their own, and then we have what we call the clinical breast exam.
Yeah.
That is done for women who are at risk of breast cancer. We usually say if a person has a risk, they should do a clinical breast exam every year.
Yeah.
They see their doctors and then they help them to look at the breast properly, examine and feel for any lump that could be there. Okay, now this one.
Wearing a bra causes breast cancer. Oh no, wearing bras will not cause breast cancer. No, it wouldn't. It doesn't. At all. Yeah. At all. Okay. No. Then
when we say they should undergo a clinical breast exam.
Yeah.
On a yearly basis. Especially, but if they have a higher risk of breast cancer.
Like genetic, first relative.
First degree relative.
Yes, first degree relative.
Or they have personal history of
breast cancer or any other cancers.
Yeah, and then they should do that one more frequently.
Yeah.
When the doctors just examine.
Also, yes, true. Also, if, for example, such persons, after doing this self-breast examination, realizes that, okay, he has a lump, what next? Should go to the physician, go to the doctor, and thereafter have more investigations to do.
Yeah.
Now, this brings us to investigations that
could be done for breast cancer. Yeah, for them, they could just be screening investigation or diagnostic investigation. Yes. For the screening, these are people who do not have breast cancers, but we are just concerned that they are at risk of having breast cancer. We usually tell them to do an ultrasound scan if they are less than 40, some say 35 years. Yes. The routine ultrasound scan will be able to pick any abnormality or any lump in the breast. Or they do a mammogram for people who are above 40 years. Yeah. We encourage them to do mammograms. And then the mammogram, it is said that a mammogram is like an X-ray. It exposes you to a little bit of radiation, but it's looking at the breast, and it's able to identify if there's any architectural distortion of the breast, if there's any mass, or if there are any speculated stuff on the breast. And then it's able to detect changes in the breast even a year before your hand can feel any change.
It's very specific.
Yeah, so it's important that people present themselves for mammogram when they have risk for breast cancer.
And also, if finally a ultrasound scan is done or they notice a lump, they can also go for, the doctor can do this, what we call fine needle aspiration cytology.
Yes. Once you notice any lump at all, you have to investigate.
The lump.
If you even think it's a fibroadenoma, for example, a small lump.
What we call breast mouse.
Yes, also. You have to remove and then take to the lab and confirm that it's not breast cancer. Yeah.
Then if we know that, okay, now this is like breast cancer, also we can do biopsy, tissue biopsy and all, histology to know the type and all. And this will help in the management of such
breast cancer.
Breast cancer. Because there are different types. We talked about hormone responsive,
non-responsive tumors like that. So now, you've done a clinical breast exam and then probably a mammogram to identify whether there are risk factors. Okay, I think we have a call.
It is Helen from Italy. Hello, Helen. Welcome to Health Talks. Feel free to communicate with us. Hello, Helen. Can you hear us?
Hello. Good afternoon.
Good afternoon. Welcome to Health Talks.
Please, yes, I want to ask the doctor some questions.
Okay.
Okay, I want to know if, as I deal with my husband, if my husband likes to talk breast, I want to know, sucking breast, it can cause cancer.
Oh, okay. Thank you, Helen. Oh, no. Sucking breast would not cause cancer. No, not at all. Actually, got that same question from
I think she's still online.
Okay, you see.
Are you still there? Hello, Eileen.
Hello?
Yes, but I want to know because my husband likes to touch my breast.
Okay, let him feel free to touch it. No problem. It wouldn't cause cancer at all.
You know, we've had cases where breast lumps were first identified by husbands.
God bless you.
The women could not even identify that they had a lump until their husbands felt them.
So you can see husbands actually have helped some of our patients in noticing breast lumps. Yeah. So it will not cause cancer at all. At all. So you are safe.
I can understand that, yes. Okay. Now, we're talking about, we're done with the mammogram. Yes. Right? Okay.
So talking about what she said now, I got a call from a relative of mine and it was like, oh, please, can sucking your breast cause cancer? I'm like, no. She's like, what are baby friendly? And why? I said, man, continue your baby friendly. Oh, it is very safe, very, very safe. Okay. So right now we're going to go on a break. When we come back, we have so much information to give you on breast cancer. Stay tuned and please don't go far from your gadgets.
What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet. What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet. What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best bet.
Hello, welcome back. We're glad to know that you're still there. We're still discussing breast cancer on Health Talk, exclusively on Celebration TV. And Dr. Amy Momo is still here with us. Yeah. Like we were saying, now breast cancer is not a death sentence. Yeah, people have to understand that early detection, treatment, and follow-up will make patients to live well. Sure. We've seen people enter into remission. When we say remission, we mean they attain a cure for years. And then they are able to live their daily life. Yeah. So being able to identify the risk factors that you may have, and working on them would as well help.
Also to add, do you know that 90 in, say, developed countries with enough financial backup, you know,
Yes, yeah.
90% of such people have this 5-year survival, meaning 90 within 5 years,
People will still live well, even at whatever. You know, that's one thing. You know, high socioeconomic class is a risk factor for breast cancer.
True.
Yeah, it's said that the richer you are, the more your chances of coming down with breast cancer. But however, we know that even in resource-poor countries, why we think the incidence is low is because they are undiagnosed.
They don't, most of them don't go to the hospital.
Yeah,
so.
but and the beautiful thing too is that in people with high social class, their cancers are usually not as aggressive as when it happens to those in low social class. Maybe because they will have access to modern treatments and they won't have apathy for medical science. I think we have a call. David from Ebonyi State. Okay. Good afternoon, David. Welcome to Health Talk on Celebration TV.
We can hear you, David. Welcome.
Okay. Now, how to ask you?
Okay.
I have a sister. I noticed that she has something like painful, like thing of her face.
Please, can you come again, David?
Hello?
Yes, we can hear you now.
Okay. I think she has something like, just like boys on her face.
Okay.
And she's pregnant. I don't know. I don't know that. If it's any sign of and she knows she takes them people like.
Unfortunately, I couldn't hear you.
Okay. If I got you correctly, you say you have a sister who have a boil where? A boil on her breast?
A boy, something like what? On her breast.
Okay.
Okay. And that she's pregnant,
Is she pregnant or is she breastfeeding?
She's pregnant.
Okay.
Okay,
she
pregnant.
has a sister who has a boil on the breast and she's pregnant. So he's worried he doesn't know what it is exactly. Okay. I believe that she attends antenatal clinics even as she's pregnant. And, we really cannot say what that is. Maybe, yeah. So she will need to be examined by a doctor. It could just be an harmless thing. Yeah, but you never can say until she's examined and then some investigations probably are done before they can identify what that is.
So our advice is when she goes to antenatal clinic, she should see her doctor and he will do some examinations on her. Because we're told that, of course, we said just 5% of this lump and all these things could be breast cancer. Yeah. But still, we should not undermine it. Also, it has also been noticed that some people might even not have cancer even when they are pregnant.
Yeah.
Yes.
It can happen like that, even in pregnancy.
So let her go to the hospital and let her see her physician or doctor. And after examination and all, and she will be cleared from it and she will be told what actually that boil or lump is. Thank you for your call.
Thank you. So we're talking about we said that also it's noted that people who have cervical cancer are protected from breast cancer.
But why would somebody want to have? Nobody want to have.
Nobody want to have cervical cancer. But it gives some form of protection against breast cancers too.
But breast cancers,
they are terrible. Terrible. Just once detected early, but we know that help is not far.
So we're talking about the socio-economic issues and breast cancer. Yeah. You know, the 5-year survival rate in developing countries, even in South Africa, according to the WHO, was about 25%. So I was like,
which is fine.
25%. When developed countries having 90%.
No, it depends when these things are diagnosed early enough. The chances of survival would as well increase.
Sure.
Yeah. That's just the part of it.
So there are some, there are some, when this cancer is noticed and treatment comes in, some people may end up being total, and we talk about total remission. They are free from this.
People are free from breast cancer for years.
Yeah.
And then they do it. Once you have attained remission for 5 years, we start talking about a cure. That this person has achieved cure for that breast cancer. Now,
we have a question here.
So what are the misconceptions of breast cancer? Yeah, I think we have dealt with some of them. Yeah, some people also would tell you that using of antiperspirants increases risk of breast cancers, which is not true. Yeah, it's not true. Except, okay. But we know that aluminum-containing antiperspirants have been, people who use them have been found to have a higher level of aluminum in their breast tissues. But it doesn't mean that it will make them to come down with breast cancers. Yeah, that's some of them too.
Okay, we have a call, Felicia from River State. Hello, Felicia. Welcome to Health Talks. We can hear you.
Thank you. I did not start with you before. I just joined you before. I want to know what causes the cancer.
Okay.
Okay. The topic?
No, she wants to know what causes breast cancer.
Okay. All right.
Now, we have said that breast cancers, usually, cancers generally, many of them would not, we can't usually pinpoint something that causes a cancer. But we know that cervical cancer is caused by a virus, the human papilloma virus. But for breast cancers, basically, we may not be able to pinpoint something that causes it, but we have risk factors that you have outlined.
Because half of such individuals with cancer do not have, actually, there's no known cause. It's just spontaneous. It came out like that.
They can just happen on their own. But we know that the risk factors that we have outlined earlier on in the program, but she said she didn't join us on time. So we can just go through them. Yeah.
Being female, obesity, alcohol, aging, at the age from 40 above. Yeah. Okay, but though there are some specific, or there are some for Africans, or let's say for the black, there are some
people even as young as 22, 25 can have breast cancer. But it's commoner as women age. Yeah. And then we have said women who are, family history, which is one of the most attached factor to it. We have said that if you have a family member, a mother or a sister who has breast cancer, your chances of having breast cancer is as high as 4 times another person who doesn't have a family history. If there are now 2 different people that have in your family, the chance would have increased to about 20 times more than somebody who doesn't have a family history. And we said that women who do not breastfeed enough, people use oral contraceptive pills too, are at increased risk. Exposure to X-rays, radiation, especially at young age, teenage age, or people who are less than 30 would have increased risk of breast cancers. So breast cancers always causes a lump you can feel. No, sometimes they may not come with a clear-cut lump. They may just come with breast changes. Your one breast becomes bigger than the other, and you start seeing skin changes too on the breast.
Yes, because there are some lumps. When this comes, it might be so tiny, you might not be able to feel it.
Yeah.
So it doesn't really come with a lump that you can feel.
Sometimes it may not just come with a
lump that you can feel. Then
breast changes.
Exactly.
Now, they are like we said, looking at preventive mechanisms.
Okay.
How do people prevent themselves from having breast cancer? We say look at the risk.
Okay.
The ones that you can modify.
You will modify.
The risks that you can change.
You change it.
You change them.
Exactly, like avoiding.
You can quit smoking.
Smoking.
You can quit alcohol. If they take alcohol.
Yeah.
They can avoid a sedentary lifestyle.
Exactly.
Get active.
Avoid sedentary lifestyle. Yes.
And then cut down if they are diabetic. They can control their blood sugars. Exactly. It would help. Yeah.
And alcohol, we don't take alcohol.
Yeah, we've said that.
Watch your weight. We said that. Okay, then all this can actually
Then-
the
then-
hormone.
Yeah, hormone, use
taking
of-
hormonal oral contraceptive for a long time.
Yeah,
You know, it
that's
can
why
cause
we
cancer.
advise that women who want to go on child spacing or family planning should not take drugs on their own. You should be examined if there is a risk factor. There are other drugs like the mini pills, progestins, do not increase the risk of breast cancers, but combined oral contraceptive does. So you are looked at and you are examined based on your family history. The correct type of family planning method is done for such a person.
So that's why you shouldn't just go on your own
And
always
start
go see
family
your
planning.
physician.
Yeah.
He will ask you so many questions. So
And
these
then
long
decide.
questions that we always ask you during clinic visits, it's not just for asking sake. We
Yeah,
know the reason
they are
why
important.
we ask you.
The question here, if I don't have a family history of breast cancer, I cannot have it. That is not true.
That's
We
not
have
true. We
seen
just said it
spontaneous cases occur in people who do not even have a family history
In
of
fact,
breast cancer.
half of the people with breast cancer, half do not. It just came spontaneous. They
Yeah,
didn't have any
it can
family
happen like
history
that.
concerning that. So I would love us to
Look at
discuss on the
Prevention.
Yeah, no, before prevention, talking about the spread. Of course, when there's a lump in the breast cancer, why how it spreads and it metastasizes and all. Why
Okay.
it's important is this: if somebody sees a breast cancer or sees a lump in the breast, it's very important to go see the physician.
Yes.
Because such breast lump, if it becomes cancer, if it
is a cancer,
what
ab
happens?
initio, yeah.
The question is, what happens?
Yeah.
What happens? That's it. First of all, most time there's something called a sentinel lobe or something.
Sentinel lobe. Okay, once breast cancer starts like that and it wants to spread, it could take several routes, the hematogenous, the lymphatic route, but to spread first, to spread to the lymph nodes, the axilla, and then one of the commonest organ that spreads to is the lungs.
Because you know why now?
Yeah.
The breast is like on
Sitting on the chest, so it can spread to the lungs and start giving them several issues. It could spread to bones too. That's why you see people who have breast cancer, a woman who has breast cancer, for example, is just sweeping and then collapse and has a fracture of the bone. They would have had a pathologic fracture. Because once the tumor cells spread to the bone, they weaken those bones, bones become weak and they can easily come down with fracture.
So what about someone who's itching inside the breast? What could be the problem? Okay, many things.
There are several things that could cause itch. It could be eczema of the breast.
Scabies.
It could just be eczema of the breast. It may not be something that is sinister. But if it has persisted, I think you should see a health practitioner, see a doctor, and they will examine you properly and find out what is causing that, and then treatment can be offered. No.
So that's what we're saying concerning the spread. It can spread through the blood, through lymphatic system and other aspects. So when they notice this lobe, the lump can be noticed at the collar region, chest region,
they can notice lymph nodes that are enlarging.
Armpits,
anywhere.
It could spread all around.
Breast cancers can spread to any organ of the body.
So
but usually has predilection for some organs. It likes some particular ones that it spreads to. And those are the ones that will lead to death of such individual. Now,
talking about such, knowing how it spread and all, it also helps us in knowing what to do when there is a breast cancer. Because most times, surgery could be, we could go for.
It depends on the stage. Depends on the stage that the woman comes at. But now, looking at some of the preventive mechanisms or preventive ways for breast cancer. Now, people who have said you have identified your risk. You already know that you're at risk of coming down with breast cancer. Some people take it far. Once they notice that they have a strong family history of breast cancer, they may want to do some investigations. Some investigations first to check for the BRCA1, BRCA2 gene, HER2
and
gene.
all these are available in developed countries.
They are also available here. They are also available, but you may just spend a fortune. Now, if you see that some of those genes are mutated in that individual, they can go as far as removing the breast tissue.
Yes.
What you call prophylactic mastectomy. That you've considered that you have a high risk of coming down with breast cancer, but there's no cancer yet.
Yes.
Some people can opt to
exactly.
have their breast removed.
Or some of them, their ovaries too.
But the funny thing is that even doing a mastectomy does not confer protection against breast cancer, because they may have left some breast tissue behind. And then once you are still exposed to hormones, estrogen is implicated in breast cancer. Once you are still exposed to estrogen levels, breast cancers can still develop. So some people can even go as far as going to remove the ovaries too. Okay.
So we have a call.
No, that's not a call.
Okay,
that's a write-up. Says from Elizabeth. What about a mature lady of above 35 years with standing breast and you feel stone in her breast is still solid and strong? I don't know if she's healthy. Wow. This is not a lump actually. I think this is just normal breast from what she's saying.
Mature, I would.
Is it she feels stone? Yeah, the write-up is not too clear.
Yeah, but she says 35 years old, she's standing, and she feels
standing.
What?
She feels stone in her breast. It's still solid and strong.
It could be.
No, I think it's just normal breast tissue she has.
Breast tissue feeling like stone. Remember,
you know, sometimes the right
she should go to the doctor and should go for an examination, because with the examination we will actually know if
whether it's normal breast tissue.
Because you know, sometimes you've seen this in seeing some patients now when they come to the consulting room and like, oh doctor, if you see this place here, oh God, it is like this. If you touch
but once you examine, you find out that it's
something else.
Okay.
This thing is very big. Oh, it's as big as my hand. I have a mass as big as my hand. Oh doctor, it's terrible. Okay, lie down, let's examine you. And you say the mass is something like this. But
I think she should see a doctor and let.
We're not undermining what she says. We're not undermining what he says. But we know what to call it, and so go see your doctor. Let her see her doctor. Then we'll be able to he or she will be able to examine and know what actually it is. But the age 35, and also with the features, I think we have to see the doctor.
I think we'll go on a break at this point.
Yeah.
Join us. Still remain with us. We'll be back in a short while.
What business are you planning to showcase to the world? That which will satisfy the need of humanity? Of course, with Celebration TV, it will get the desired reciprocation you long for. We are committed to giving your business and services that quality touch of class, and you will be happy you made the right choice by placing that investment of yours on the right platform. Without delay, you can call on this number for your advert placement, partnership, or sponsorship of our programs. Celebration Television, your best.
Yeah, welcome back. It's nice knowing that you're still with us. We're still on network. Dr. Amy.
Yes. So some preventive measures concerning this breast cancer. Preventive measure is very important. As we say, our advice to our viewers is this. You have to watch your weight, do exercises, avoid smoking, avoid drinking.
Yeah.
Also, avoid long-term use of hormonal contraceptive.
Except when prescribed.
Exactly, except when prescribed.
See a doctor when those ones are prescribed for you. If you have a family history, then you should be aggressive in your follow-up.
Yeah.
They should have breast self-exam done regularly.
Do your breast
They should have clinical breast examination done.
And if you have the opportunity of doing your gene typing,
which is fine.
Mostly when you have a history of breast cancer, maybe your mom or something.
They should do those ones too. And then they should see their doctors if they may have follow-up drugs. Some people may end up using medications once they are above 35 and they have given birth to their children. We can give them drugs that will help to suppress hormones too. Hormonal suppression. So it will reduce the incidence of breast cancer.
So remember to see your doctors and remember to stay healthy. Thank you for this beautiful time with us. I guess you all enjoyed this time, and I guess you gained so much on this breast cancer. And we hope and pray that none of your relatives would have this. And if your relative or anyone have such breast cancer, remember to support them emotionally, psychologically, and spiritually by praying for them. Be always with them because they need you. Thank you very much. This is Health Talks, and I remain Dr. Amy Momo, and this is
Thank you, knowing that you've been there all along. God bless you.
So have for now, weekend. Have a nice weekend. Have a nice week. Bye. As kids, as teens, as youths, and as the elderly, countless times we have been told that health is wealth. While many may have already grasped the understanding, others perhaps find it difficult to explain the connection. It definitely takes a healthy body to make wealth. Or imagine spending your entire income just to stay healthy. I am Dr. Amy Momo. Join me and my colleague, Dr. Keats, on Health Talk, where your health is our priority, bringing you medical, professional, and essential health tips and discourse, exclusively only to Celebration TV, live every first and third Friday of the month, 2 p.m. to 3 p.m. GMT +1. Health Talks, your health, our priority.
Refill